Well, good afternoon, everyone. It really is great to be here. And as I begin, well, first, my name is David Lakey. I'm the Commissioner of the Texas Department of State Health Services. I think most of the folks here I've had the privilege of interacting with on multiple occasions. But I want to begin by thanking Representative McClendon for doing this. This is important. And it's important on many different levels. I think that it's very important from the human aspect, our family members that are affected, and being able to put a face with an issue and sharing your personal story up in front of a bunch of folks is not easy. And so sharing that your own personal story is really powerful to be able to drive home how important an issue like this is. I think it's also very important from an economic standpoint. We spend a lot of money taking care of preventable issues, and I think we need to get smarter on those type of issues. And so I'm going to talk a little bit about that. And it's also very important from a disparity issue. That I'll talk about some of the progress that's been made in the state of Texas and nationwide. But in a lot of the slides, you'll see that progress is different in different ethnic groups, and we have a long ways to go in different ethnic groups in the state of Texas. And I'm also, again, talk about some of the progress that we've made. I start a lot of my discussions in academic presentations with a slide like this. If we want to look about how we're doing in health, I think one of those measures is how are we doing related to how long people live, life expectancy. And if you look at the slide, you will see that there has been progress if you look at the long-term span over 20 years. But that bottom line in life expectancy is the life expectancy for individuals that are African American. And you can see that we still have significant disparities in our state. That if you go back 20 years, that gap was about 6 years. We've narrowed it down to about 3 years. But the amount of time that you have on Earth is different right now, depending on your ethnic background. On the next slide, if we want to address these issues, how can we be smarter? And you have to look at why do people die. And if you look at the data, it's much different now than it would have been 50, 70 years ago. If I gave you the top causes of death 50 years ago, it had been infectious diseases. It is now chronic diseases. And if we want to make progress in health in Texas, we have to get better at addressing these chronic diseases. And so you'll see the number 2 cause of death in the state of Texas is malignancies. And I'm not going to repeat some of the data that has already been demonstrated, but if you drill down on those malignancies, the number 2 incidence of malignancies of cancer is lung cancer. Number 1 cause of death for both men and women for cancers is lung cancer. And that's why this is so important. As we discussed earlier, it's not even close. If you add number 2 and number 3 up together, you still don't surpass the number of people that die in the state of Texas because of lung cancer. On the next slide is a slide that we've been using for about 10 years now in public health. That we talk about the diseases. If you drill down to the behaviors, there's specific behaviors. And we've talked about obesity already, and we've talked a little bit about tobacco. But these are the drivers of those poor health and those diseases that come out on the previous slide. And so if we want to get better at improving health, getting better at our attack and tobacco and obesity and substance abuse will have a huge impact on how we can drive improvements in health. Now, as I noted, that there has been progress. I think we have to look at how we've improved over the last several years. If you look at cancer deaths, there has been progress in the right direction. But again, if you look at that top line, that's the rate of cancer deaths for African Americans, and it is significantly different than cancer deaths for the rest of the population. Now, on the next couple slides, a lot of this data has already been covered. And so just to summarize, we can look at the rates, and the rates are different in different ethnic groups, and the rates of incidence are higher in the African American population than in other ethnic groups. And if you look at mortality data, which was on the next slide, again, significant differences in mortality rates due to cancer. This is cancer as a whole. So a couple of cancer facts before I go on to talk specifically about lung cancer. One, in 2014, more than 119,000 Texans will be diagnosed with cancer. 119,000 Texans will be diagnosed. And out of that, 44,000 Texans will die from cancer. And that's why it's such an important issue for us. But again, besides that human toll, there is an economic toll related to this. The total annual cost associated with cancer in the state is estimated, if you look at all the costs, $30 billion. That's a lot of money. On the next slide, 2 slides, I have some of that data, again, that's already been presented related to lung cancer incident. And again, you see that the rates are higher in the African American community for both incidence and on the next slide on mortality. And you'll see when you look at those slides, the rates are higher in males than they are in females. But again, I think you have to look over how we've progressed over many years, and I have that on the next slide. If we look at age-adjusted mortality rate, it's moved in the right direction, and it's in many ways moved in the right direction because of things that we've done as a society, things that we've done in the state of Texas to address this issue. But again, the rates are significantly higher in the African American population. So in summary, on the lung cancer disparities, and we've already talked about this, but again, what an impact tobacco has, with over 90% of all U.S. lung cancers directly linked to cigarette smoke. And we also noted that the difference between the incidence and a higher incidence of mortality and the issues of disparities, and we need to keep focusing on this and figuring out why we're not getting individuals into treatment as quickly as we can. Why are they not getting the treatment that they need? What we can do to improve the treatment side of this problem. Now, my other point is that it's preventable. There's things that we can do in order to have an impact on the number of people that are dying in our state related to lung cancer. About 50 years ago, the Surgeon General of the United States came out with his report that showed the harmful effects of tobacco. It's not new information. We build upon that information, and we've, over subsequent studies, and have shown the effect of secondhand smoke, et cetera, but there's no question that tobacco is a carcinogen, and if we can decrease the rates of tobacco, we can have a profound effect on the number of people dying from lung cancer. Tobacco control programs have prevented about 800,000 lung cancer deaths over the last quarter of a century. We could have done, if everyone would have stopped smoking, about 3 times that many people would have been saved. And the interventions work when we educate individuals, give them the facts, do things that make sense, we can have an impact on this. On the next slide, if we look at smoking, I think, and this slide is very typical to a lot of the health outcomes that we see in the state of Texas, that the rates are higher in certain ethnic groups, but also the more education you have in the state of Texas, the more money you make in the state of Texas, the more likely that you'll have healthy behaviors, the less likely that you will be to smoke. So how are we doing related to tobacco use in Texans? This slide demonstrates how we're doing related to adults age 18 and above, or 25 and above, and you see the comparisons between Texans and United States as a whole. And you can see overall there's been a general trend, and our rates are a little bit better than some of our other states, but we still have a ways to go. On the next slide, I have data for individuals that are my children's age. I have 2 kids in this age group, between 12 and 17, and the use of tobacco is going down. And I think that's good news. It has a very different connotation than it did when I was a kid. People are starting to learn the consequences of tobacco. And I think part of the good news, which is on the next slide, is there's a lot of folks that want to stop smoking. And again, if you drill down, and I think this is one of the good parts looking at the ethnic differences, that a lot of African Americans that currently smoke want to stop. And things we can do to be smart in order to equip them to be able to do that potentially life-saving endeavor and that change of behavior. On the next slide, I just have a comparison of how we're doing related to, this comes out from the United States Health Rankings. And we do a little bit better than some of our other southern states, but we still have a long ways to go. On the next slide, I want to talk a little bit about some of the things that are occurring in the state of Texas on this issue. And unfortunately, Representative Crownover had to leave, but I wanted to thank her for being such a hero champion on trying to address the secondhand smoke issue here in the state of Texas. That this really is an important issue, and that if we can prevent secondhand smoke, we will save health consequences for an enormous number of individuals. If we look at what's happening in the state of Texas, and it'll be on the subsequent slide, but stay on this slide right now, Texas is gradually, in the absence of a state ordinance, municipality by municipality, are changing the smoke-free ordinances in their communities. Right now, in 2013, greater than 8 million Texans, about 44% of Texans, live in municipalities that had 100% smoke-free protection in all 5 domains. And I won't read those domains, but you can look through them on your own. And the total number of Texas municipalities with secondhand smoke ordinances is now at 273. So on the next slide, you can see what's happening in the state of Texas. Gradually, year after year, Texas is going smoke-free as city and communities decide that that's what they need to do in order to protect the people that live in their jurisdiction. And on the next slide, you can see I've mapped out where those jurisdictions are, and it's throughout the state of Texas. On the next slide, and in the subsequent slides, a couple of things that we're doing in the Department of State Health Services that I think will have a tremendous impact. We have a tobacco prevention program. The goals I have listed here, but a really concentrated effort to make sure that our kids don't start this habit that they'll want to stop 10 years later. That we need to continue to educate kids so that they do not pick up this habit. That we need to ensure that people comply to the tobacco laws. And so we do a lot of work with the people that sell cigarettes to make sure that they're not selling them to my kids or to your kids, that they are obeying the law. We also have been working to increase cessation among young adults and people and adults, so that if I was a smoker and I wanted to stop, that there would be resources out there, that there's a quit line, and we partner with other entities to provide in the state of Texas so that I could call that line, I could get nicotine replacement therapy, I could get counseling, I could be educated so I would know what I needed to do to stop smoking. And looking at health disparities. Again, a lot of our efforts work in the groups that have the highest rates of tobacco and making sure we use data to drive what we're doing in our state. The next slide, some of those initiatives, so those are the goals. Some of our initiatives include public awareness. And I'll talk about this in a subsequent slide, but working in specific communities, using the limited resources that we have in communities across the state to provide education, bringing the community together to address these issues, and making this information about the quit line and other resources available. We're working with the comptroller and the FDA to make sure that we are enforcing tobacco law in the state of Texas. And on the next slide, again, a big part of what we do is trying to make sure that the quit line is available to Texans wherever they live. And so you can call this number and they can guide you on how you can get the services that would be beneficial. Next slide. I think one of the opportunities for us is to make sure that the clinicians out there throughout the state understand how the system works, where the quit line is, and how they can access this, and that they refer individuals to the system so that they will stop using tobacco. And on the final slide, again, some of those evidence-based cessation programs, working with the coalitions across Texas where we have the funding, and we have the data to show that when we do that, the uptake of the quit line, the use of the quit line is much more effective. And working with physicians, electronic medical records, so that we can enhance the use of the quit line. And so I want to thank you again for being able to be here today. You know, as I was thinking about this, Representative McClendon, and again, thank you for being the face of this. I was thinking about a person named Leroy, and Leroy, when he was young, had a lot of different habits than he has today, and he smoked a lot, and he drank a lot, and he decided he'd stop. And so I got to, about a month ago, Leroy is still working. He is 80, and I got to celebrate his 80th birthday with my dad. And so I think that is what can happen when people change early enough and change their behavior, that they can have that long, healthy life. And so again, thank you for the work that you do. Thank you.